Have you traveled recently or plan to travel?
No, I don't have the money to travel.
Okay. And what is your current living situation?
I live in a sort of a housing unit by myself.
Okay,
Um,
so you live alone. Okay. Do you engage in physical activity, exercise?
no, not really. I try, but I mean, I think about it, but no,
Yeah.
I don't know. I just can't find it in me to do that.
Yeah. Well, sometimes it's hard to get motivated to exercise.
Mm-hmm.
And it sounds like you have a lot going on right now that might be getting in the way, so that makes sense. And what do you think you can do to be more healthy right now?
I don't know. I guess I'm here because I feel like I need to be better with the whole sex thing and maybe not drink so much, and so yeah.
Okay, can you talk to me a little bit more about better with the sex thing?
I guess the guys, I guess what they call promiscuous, and I don't feel good after, after I have sex. I feel used and really gross and dirty.
Okay.
So
Okay. So why don't you tell me a little bit about why you're here today?
I'm not feeling very well in my down below.
Do you have direct pain or is it burning?
I do. It's really uncomfortable right now.
Does it hurt
to
when you
even just
urinate?
sit here. Yeah.
Okay. I'm
Yeah.
sorry that I interrupted you.
No, it's okay.
Okay. And from what I understand, when you first called, you had mentioned that you do not feel comfortable with a vaginal exam, which has caused you to kind of delay this appointment today. Is that true?
Yeah, it hurts. The last time I had it really hurt. And I don't know.
The last time you had a vaginal exam, it hurt?
It was a long time ago.
How long ago would you say it was?
It's got to be years now. I don't really remember.
Okay. And do you still have a period? A menstrual cycle?
Not really. I mean, it's off and on, so I guess, I don't know, maybe I'm going through menopause right now.
Okay.
And maybe that's part of it, Some of the women my age say that it gets dry and it doesn't feel very good.
Okay. Have you ever learned about ways to have sex when you are going through changes in your vaginal wall, that you can use different lubricants and things to prevent it from feeling painful? Those are some options that we can discuss later today if you'd like.
Yeah, I guess I'd like that.
Okay. And so the itching and burning, did you say itching as well, or just primarily burning?
It's itching. It's very uncomfortable right now. Like
Okay.
I said, I am having a hard time sitting here.
Okay. Well, the good news today, Jenny, is that if you decide you do not want a vaginal exam, there are options for us to be able to take a urine sample of what's going on for you and be able to determine if there is any indication of a sexually transmitted disease or a sexually transmitted infection. I know that's a scary thought. However, we're here. We specialize primarily in helping people with those issues, and we also can offer prescription medications dependent upon what's going on for you. If that is the case, we can help you to treat it in the best possible way. So as far as the vaginal exam is concerned, we do a vaginal exam for a number of reasons, but one of the primary reasons is to check for cervical cancer. And we offer a very, a kind of a different environment than you would if you went to your gynecologist. Me as the clinician counselor, I can actually be in the room with you when you do have the vaginal exam to be there as a support. And that's another option for you to consider. But we do recommend a vaginal exam. If not today, then maybe coming back at a later time to have that done. Maybe think about this for a little bit and consider those options as well.
Okay.
Okay. So what I'm going to do is I'm going to introduce you to the nurse. She's going to give you a cup for your urine sample. We're going to take those tests today, and you can have the results by the end of the week. Okay, and then from there we'll go, we'll move forward with medication and treatment.
Okay.
Okay, all right. Thank you very much for coming in today. And again, if you do decide to have the vaginal exam today or decide to come back for it, I can offer that additional support for you.
Okay.
Okay, do you have any questions?
Will I have to take off all my clothes?
That's a really good question. So we do provide a Johnny for you. You familiar with a Johnny?
Mm-hmm.
It's the nightgown that you've had maybe at the hospital or at the doctor's office before, and basically it covers everything except the back. We'll have you get changed into that, and then you'll be seated on the exam table. That is specifically for the vaginal exam. For the STI and STD testing, which is sexually transmitted disease and infection, you will not have to change. You will not have to be part of an exam. You would just be taking the urine sample today. So you'd literally be out of here in 5 minutes.
Okay.
Okay.
I can handle that.
But if you do have a vaginal exam, you will also have a breast exam as well. That's according to what you're comfortable with. Do you do routine breast exams at home? Okay. Well, if you decide not to have it done with the nurse today, we can also go over some how to do some self-exams at home so that you can make sure that you're healthy in that area, okay?
Okay.
All right. Well, it was nice to meet you, and I'm glad you came in today.
Thank you.
Okay. Thank you.